Welcome to Black History Matters 2022, presented by the National Abolition Hall of Fame and Museum, also known as NAHOF, located in Peterborough, New York. Black History Matters is an educational series that seeks to highlight historical events in the Black American experience. This series consists of 28 videos that NAHOF will release daily through the month of February 2022. Videos are viewable on NAHOF's website. The mission of the National Abolition Hall of Fame and Museum is to honor anti-slavery abolitionists, their work to end slavery and the legacy of that struggle, and strive to complete the second and ongoing abolition, the moral conviction to end racism. This program was funded in part by Humanities New York, with support from the National Endowment for the Humanities. Any views, findings, conclusions, or recommendations expressed in this program do not necessarily represent those of the National Endowment for the Humanities. It is now my pleasure to introduce today's presenter, John Bowen. Dr. Bowen is an OB/GYN physician living in Hamilton, New York. He serves on the Cabinet of Freedom of the National Abolition Hall of Fame and Museum in Peterborough, New York. Dr. Bowen grew up in the burned-over district of upstate New York, and since his childhood has been interested in the rich history of the area. I'd like to now invite Dr. Bowen to begin his presentation.
Thank you, Victoria. Today, I'm going to talk about some 19th century women who made an enormous contribution to current worldwide medical care. Most of them disappeared nameless and unrecognized by history. Of all those women, we can name only three, and only by first name: Lucy, Betsy, and Anarcha, the mothers of gynecology. Advances in medical care rank high among the miracles of modern life. In my lifetime alone, we've witnessed the near eradication of polio by vaccines. Antibiotics for a wide range of infectious diseases have been discovered and modified to meet the ever-changing challenges. Enormous progress is made in the prevention and treatment of heart disease, early detection of cervical cancer, and now vaccines to prevent cervical cancer have dramatically reduced the resultant suffering that was commonplace when I was in training. I concluded my career performing surgeries never imagined when I was in medical school. Unfortunately, not all people have benefited equally from these advances, nor has the price of progress been borne evenly. African Americans in particular have paid a high and largely unrecognized price for medical progress and have disproportionately failed to reap the rewards. I want to begin this discussion with a little story. On the very first day of medical school, my class was welcomed by a string of deans and professors. I remember none of it, except for a short talk by a young clinical instructor of medicine. He told us about a particular little event during his training. He was in a lecture on the topic of Wilson's disease. Wilson's disease is a rare disorder in which the body is unable to eliminate copper. Over time, life-threatening levels of copper accumulate in the liver and brain. One of the signs of the disease is a deposition of copper in the cornea of the eye, called a Kaiser-Fleischer ring. The rings are difficult to see without shining a light at just the right angle to the eye. To illustrate his lecture, the professor brought a morose young boy to the front of the lecture hall for the students to examine. The students lined up to take turns shining the bright light in the subject's eyes and peering into the child's face. At last, one student turned to the professor and admitted sheepishly that he was unable to see the rings. Before the professor could chastise the unlucky student, the boy spoke up and muttered in a monotone, "Turn the light oblique to the eye." I repeat this story because it is easy for us to neglect the person behind the finding or disease. Our patients are not simply subjects. They can be our colleagues, partners, instructors, and friends if we only take time, set aside assumptions, recognize biases, and listen. They deserve our respect and to be remembered for their contributions to our education. And so let us turn and remember the names of three 19th century enslaved women, Anarcha, Betsy, and Lucy, the mothers of gynecology. I wish I could start this talk with a contemporary image of these three women, but none is known to exist. I'll come back to that. Instead, let us start here. This is Dr. James Marion Sims. Almost all of what we know of Anarcha, Betsy, and Lucy is through their contact with him. If they ever did tell their stories, they are not recorded, and almost nothing tangible remains of their lives. At the time of his death in 1883, Dr. Sims was widely known as the father of modern gynecology, one-time president of the American Medical Association and founder of the New York Women's Hospital. In this image, he is displaying some of the medals awarded by various medical societies and crown heads of Europe. Unlike Lucy, Betsy, and Anarcha, statues were erected in his honor, and portraits hung in hospitals and state houses. Dr. Sims was celebrated for developing a successful surgical repair of a birth injury known as vesicovaginal fistula. Vaginal fistulas are fortunately rare now in this country. There's no delicate way to describe this affliction. Vaginal fistulas are a traumatic communication between the bladder or rectum and the vagina brought on by sexual trauma or injury sustained during difficult childbirth. They allow for continuous uncontrollable leakage of urine or stool through the vagina, resulting in chronic painful irritation of the skin, soiled clothing, and constant foul odor. Prior to modern obstetric care, obstructed labor and the efforts to relieve it invariably resulted in stillbirth and set the stage for fistula formation. The mothers who survived suffered not only the loss of a child, but the lifelong pain and degradation. They were often rejected by spouse and family and suffered social isolation and depression. Women at highest risk are at the extremes of childbearing age or extreme multiparity in the setting of poverty, neglect, physical abuse, malnutrition, and disease. Such were the conditions of American slavery, and enslaved women bore a disproportionate burden of these injuries in the Americas. By the late 20th century, Dr. Sims was a nearly forgotten relic of history, his statues and portraits unrecognized. Until recently, I suspect most physicians knew nothing of the man behind the Sims speculum or the Sims position. Most surgeons in training have little time to venture into the history chapter of their textbooks to read the few paragraphs devoted to Sims. This short synopsis is from one of my 1985 textbooks. During these pre-anesthesia and pre-asepsis days, a Southerner, J. Marion Sims, began his experiments on the cure of vesicovaginal fistulas. The term experiments is appropriate since 4 years of experimentation elapsed before his first success. Sims had a successful career in surgery as practiced in those days in Montgomery, Alabama. He had no experience in pelvic surgery. In fact, he disliked it. His slave-holding planter friends owned female slaves who had been delivered by midwives, and some of these slaves suffered from large vesicovaginal fistulas, then considered incurable. With this disturbing condition, the slaves were unacceptable as house servants. One of Sims' planter friends pled with him to attempt to cure the woman. He worked on a group of these Black women from 1845 to 1849 before attaining his first cure. During these years, he housed and boarded the patients at his own expense in a small building he constructed for the purpose on his own property. His many failures only stimulated his determination and efforts. The colleagues who first assisted him at the operations forsook him, and his friends begged him to give up what appeared to be a hopeless effort. So he trained other slave patients to assist him in operation. In his 29th operation on one patient, he was finally successful in closing her vesicovaginal fistula. That brief summation of Sims's career raises more question than it answers if one is so inclined. It pushes us to imagine the slave world of early 19th century America, exploitation of women, particularly Black women in bondage, the violence those women endured, their neglected pain, the mindset of men of science, white perception of Black people, issues of consent, the ethics of operating without anesthesia or asepsis, the role of medicine and science in service to slavery, the contradictory and conflicted relationship between Sims and his slave assistants, the assumption that delivery by slave midwives was inherently more dangerous than the obstetric care rendered in the big house. We will see shortly that Sims himself was no better at prevention. It glibly glosses over a world in which a class of women was valued only for its ability to work or to bear the next generation of slave labor. The only concern mentioned was acceptability of these women as house servants, nothing about the pain and degradation the women endured. Try to imagine that small building at the back of the Sims home constructed for his experiments. Sims was born in Lancaster, South Carolina. He was educated at private academy and South Carolina College. He attended the Medical College of Charleston and then enrolled at the Jefferson Medical College in Philadelphia, graduating in 1835. He returned home to practice, but after the deaths of his early patients, of two early patients, moved from South Carolina to Montgomery, Alabama. There he developed a large practice serving the local plantations and the large slave population. It was in this setting he was brought his first fistula patients. During the period of 1845 to 1849, he operated on 10 women, all slaves. 3 are known by name: Betsy, Lucy, and Anarcha. When they were brought to Sims' crude slave hospital, they had no say in their disposition. They had no idea they would be leased to Dr. Sims for 5 years of work and repeated invasive surgeries, or observed in those early failed operations by a dozen visiting doctors. Lucy was his first subject. She was an 18-year-old woman suffering from a fistula resulting from a traumatic delivery 2 months earlier. At first, Sims considered her incurable, but later consented to try, the consent being his, not hers. Sims reported she shrieked in pain and had to be restrained. Lucy endured the surgery and excruciating recovery, nearly dying of sepsis from a sponge left in place to drain the bladder. Anarcha was a 17-year-old with a severe pelvic bone deformity resulting from rickets or lack of vitamin D. Her contracted pelvis made it impossible to give birth. After 3 days of failed labor, Dr. Sims was called to assist in the delivery of her stillborn child. 2 weeks after the delivery, she was brought back to Sims with both unhealed vesicovaginal and rectovaginal fistulas. She endured 30 operations before she was declared cured. Sims not only experimented on these women, but trained them to be his surgical assistants. As such, they would have known more about surgical technique, pre- and post-operative care than any surgical team in the country. As skilled as they were in cutting-edge medicine, they remained slaves in service to the Sims family. Sims published an account of his work in 1852 in the American Journal of Medical Science, and later in more embellished detail in his autobiography. Capitalizing on his success, he left Alabama and his unpaid and unrecognized assistance to establish himself in more prosperous New York. He achieved fame in his new cosmopolitan setting. In 1863, he embarked on a tour of Europe to demonstrate his skills. He claimed to have operated and cured Empress Eugenie of France. His select skilled team of Betsy, Lucy, and Anarcha remained in bondage and vanished from the record. Dr. Sims was not the first surgeon to experience on enslaved women. Dr. Sims was not the first surgeon to experiment on enslaved women, nor the only one to view Black people as suitable subjects. John Peter Medawer, a slave-owning surgeon, operated a private medical college in Prince Edward County, Virginia. He is known for the first cleft palate repair in America. He performed the first successful repair of a vesicovaginal fistula on a white woman in 1837. He attempted the same operation on a 20-year-old enslaved woman, but after multiple attempts, admitted failure. In his own words, he described his failure in an 1847 article in the American Journal of Medical Science, saying, "I continued to repeat the operation twice a year for 8 times, and finally had to relinquish the case. I believe this case could have been cured in the process of time, more especially if sexual intercourse could have been prevented." In other words, he blamed the patient. Ephraim McDowell of Danville, Kentucky, a pioneering abdominal surgeon, is known as the father of the ovariotomy. Following his successful removal of a large ovarian tumor weighing over 20 pounds from Jane Chad Crawford, a white woman, on Christmas morning, 1809. Her recovery was miraculous, given that in the pre-antibiotic and pre-anesthesia era, opening an abdomen meant almost certain death for a patient. McDowell, an elite Virginian and slave owner, received his medical training in Scotland. He considered Mrs. Crawford's surgery experimental and told her so before she consented. This statue of Dr. McDowell stands in the center of the Kentucky State House. A second copy resides in the U.S. Capitol building. If you look carefully, Mrs. Crawford's tumor rests in the bowl behind him. This highly stylized painting was commissioned for the Wyeth Pharmaceutical Company and used in advertising in the 1940s. It appears to be a movie still from Gone with the Wind. Dr. McDowell is already posing for his statue. Brave Scarlett O'Hara is surrounded by the stock characters of the day. McDowell is known to have performed similar surgical experiments on at least 8 enslaved women. One died. There may have been others. It is unknown but doubtful that they were counseled on the risks or asked permission. McDowell published his experiences in 1817 in an article entitled 3 Cases of Extirpation of Diseased Ovaria. His work was met with derision outside of Kentucky. European doctors refused to believe such daring medical progress was occurring on the American frontier, or that it could be applicable to genteel, delicate continental women. British surgeon James Johnson, calling McDowell a backwoods Kentuckian, wrote in a scathing journal review saying, "All of the women operated upon in Kentucky except one were negresses. They will bear cutting with nearly, if not quite, as much impunity as dogs and rabbits." These men and others believed they could experiment with impunity on the slave population. Sims reported that he did not operate without consent of his patients. He maintained their fistula pain was so great that they willingly submitted to any procedure that might offer relief. But was any individual invited to negotiate her care or possess any degree of free will under the rules of slavery? The women brought to Dr. Sims were owned by their masters, and any consent was ultimately came from the owners, not the suffering patients. Physicians worked in the service of perpetuation of slavery. They were employed to examine and assess the health of slaves prior to purchase, especially after the banning of importation of African slaves in 1809. They were called upon to evaluate and maintain the increasingly valuable reproductive potential of enslaved women. This required a mindset that further dehumanized the slaves and increasingly humiliating examinations. It is telling that Sims and his planter friends were more concerned with the patient's suitability as house servants than their well-being or self-esteem. These men implicitly believed Black people were something different. They subscribed to a European science that assumed and supported the notion that Black people were naturally suited to bondage and hard labor, mentally inferior but strong of body, insensitive to pain and tolerant of field labor and corporal punishment. Black women were seen as without modesty or intelligence, suited for directed breeding, as well as subjects for humiliating medical demonstrations or procedures. Dr. Sims' alma mater, the South Carolina Medical College, advertised to prospective students that no place in the United States offers as great opportunities for the acquisition of anatomical knowledge, subjects being obtained from among the colored population in sufficient number for every purpose. How did these medical pioneers reconcile their beliefs with what was daily before their very eyes? They maintained the Black body was something primitive or inferior, but dissected it and experimented upon it to advance the care of white people. They thought the Black body more suited to hard labor, and yet couldn't avoid seeing the broken bodies, malnutrition, malaria, cholera, and premature death in the field workers. They believed the enslaved women were especially fit for frequent and repeated childbirth, but couldn't ignore the disproportionate maternal mortality, stillbirths, fistulas, and fallen wombs, or heartache of broken families. Enslaved women were depicted as irresponsible and childlike, but Sims trusted Lucy, Betsy, and Anarcha with the exacting detailed work of surgery and care of the sick. Sims believed his Black patients did not feel pain in the same way as whites. yet he found it necessary to restrain them and reported on their agony. He and Dr. McDowell must have known the fallacy of statements like, "They bear cutting with the impunity of dogs and rabbits." A repaired vesicovaginal fistula is considered a highly vulnerable to recurrence, especially if subjected to repeated trauma. Women today are advised to avoid intercourse until healed and avoid future pregnancy or deliver by planned cesarean section. These options were not available to Sims' patient. They were returned to the ravages of field labor and expected to return to the task of procreation. They were at risk for sexual abuse and recurrent devastating fistulas. Dr. Mettauer blamed his failed attempts at curing his 20-year-old patient of her fistula on sexual intercourse, presupposes that she had any say in the matter. An 1850 census from Montgomery shows one of Dr. Sims's slave patients having a 2-year-old mulatto child, the only mulatto among 17 slaves in the household. It suggests a blatant disregard for the well-being of his patient. After his white colleagues abandoned him, Sims trained his enslaved patients to be his surgical assistants. He entrusted these women, supposedly mentally incapacitated by their gender and race, with assisting his research in advancing cutting-edge surgery. Having spent my entire career in operating rooms, I know the value of a coordinated, skilled team. It's not all about the surgeon. Surgical teams take time to build and depend upon clear communication, determined listening, individual intelligence, mutual respect, and coordinated team learning. Each member knows the procedure and anticipates each step. It's almost a melding of minds. Each team member is respected and encouraged to speak up. I can't imagine Sims succeeding without suspending the rules of slavery in the operating room. He must have recognized the skill and intelligence of those women. I'm sure Lucy must have had occasion to say, "Dr. Sims, try this." Or from Betsy, "Dr. Sims, let me show you." We will never know. A 2019 play entitled Behind the Sheet by Charlie Evan Simpson, based on Lucy, Betsy, Anarcha, and Dr. Sims, imagined that relationship hidden in the world of slavery. In 1853, Sims left his Alabama slave hospital and abandoned his skilled team to the ravages of slavery. Lucy, Betsy, Anarcha, and the others disappeared. Dr. Sims moved to a Madison Avenue office in New York City. In 1855, he founded the Women's Hospital, finding fame and fortune treating the wealthy. He demonstrated surgeries on indigent women in his operating theater for medical students and other doctors. Many of those women were Irish immigrants, another class of women with minimal social standing or protection. After a break with the board of the Women's Hospital over reluctance to admit cancer patients, he founded New York Cancer Hospital, America's first cancer institute. During the Civil War, he toured Europe and supposedly treated Empress Eugenie of France for a fistula. There's some evidence that this medical tour was actually a cover for his efforts at gaining support for the Confederate States at war with the Union. After his death in 1883, a subscription was mounted to erect a statue in New York City in Sims's honor. Funds were collected, and this statue was placed in Bryant Park. In 1932, the park was cleared of all statues in order to erect a temporary monument for the bicentennial of George Washington's birth. At the conclusion of the bicentennial, New York City Parks Commissioner Robert Moses was in no hurry to replace Sims, and he seems to have been misplaced for a time. In 1934, the statue was rescued by the New York Academy of Medicine and placed in a niche in the Central Park wall across from its home on Fifth Avenue. There he stood unrecognized until neighbors forced his removal in 2018. The story of the statue is told in detail by J.C. Hallman in an essay in Harper's Magazine titled Monumental Error. Portraits of Sims are quietly disappearing around the country. This painting by Robert Thom from 1952 was commissioned by the Parke Davis Pharmaceutical Company as part of its Great Moments in Medicine series. Copies of this image and many others were widely circulated to doctors' offices across the country. Through successive corporate mergers, it is now owned by Pfizer and stored out of sight at the University of Michigan. It depicts Dr. Sims contemplating his first fistula patient, the docile and fully clothed Lucy, while his two assistants appear skeptical but willing to watch. Two slaves cower in the background. This calm scene in no way resembles the description Sims wrote in his autobiography. This painting, Medical Giants of Alabama, hung over the fireplace of the University of Alabama Center for Advanced Medical Studies from 1985 until 2006. I am embarrassed to say it was commissioned in 1982 for the 1985 institution of the James Marion Sims Endowed Chair of Pelvic Surgery. The men with Sims and his speculum in front are gathered around but uninterested in the suffering Lucy lying in the center. Nothing could more clearly depict the utter disregard for the Black subject on the operating table. The Sims chair was renamed last year, and the painting has been removed. What is the legacy of Betsy, Lucy, Anarcha, and Dr. Sims? Clearly, their pioneering work delivered a cure to an age-old debilitating condition. Dr. Medawer and McDonald were groundbreaking surgeons with lasting impact. Unfortunately, those most in need, that is, slaves, former slaves, and indigent women, were unlikely to receive care or benefit from their pioneering work. Those who paid the highest price in pain, suffering, and even death have received no credit and remain nameless, but for Betsy, Lucy, and Anarcha. Today, with better public health and obstetric care, fistulas are rare in the developed world. That is not the case in impoverished or war-torn areas. It is estimated that 100,000 women today suffer from fistulas in sub-Saharan Africa. The region's fistula clinics are now the best in the world, but inadequate in number. The surgery itself is little changed from that demonstrated by Dr. Sims, except the women are treated with dignity and respect, and the surgery is performed under anesthesia in a sterile setting. Many of the erroneous notions about race so blatantly demonstrated by these 19th century men persist and continue to impair delivery of medical care. The 2016 study by Kelly Hoffman, titled Racial Bias in Pain Assessment and Treatment Recommendations, False Beliefs About Biological Difference Between Black and Whites, surveys medical students and residents at the University of Virginia School of Medicine. The study revealed that a number of respondents believed that Blacks age more slowly than whites, have thicker skin, and have less sensitive nerve endings. There was a correlation between these answers and how they would recommend pain treatment in different scenarios. These attitudes impair careful listening, concern for comfort, clear communication, and trust. They stand in the way of quality medical care. They lead to outcomes that neither doctors nor patients desire. Studies continue to report disparities in health measures, treatments, and treatment outcomes. Black women across socioeconomic levels are 3 to 4 times more likely to die in childbirth. Infant mortality is twice as high. Cervical cancer is now largely preventable, but Black women continue to have late-stage diagnosis and are 1.5 times more likely to die of cervical cancer. Recent patients to receive chemotherapy for ovarian cancer and had worse survival outcomes. The study also pointed out that of 62 Black patients who were deemed too high risk for chemotherapy, 31 had a risk profile similar to the profile of white patients who did receive chemotherapy. There are many more examples. My hope in presenting a small bit of this history is for it to open our eyes to abuses of the past, break down in distrust, and inspire us to examine some of our own implicit biases and eliminate those differences in outcomes. I am not alone. The American College of Obstetrics and Gynecology, along with a number of other professional medical organizations, has designated February 28th and March 1st days that bridge Black History Month and Women's History Month for the formal acknowledgement of Betsy, Lucy, and Anarcha. Last year, the American College of OBGYN published a joint statement Collective Action Against Racism. The statement contains 7 action points and pledges, through active listening, discernment, and humility, we will individually and collectively expand upon these actions and objectives as we undertake a commitment to embrace anti-racism, learn and unlearn, change the culture of medicine, and eliminate racism and racial bias in the delivery of women's health care. The college's Green Journal has recently appointed an associate editor of Equity. ACOG has been posting daily statements by members across the country on how they honor Black health and wellness. One woman posted how she now asks for the Lucy speculum when in the operating room. Her team knows exactly what she is referring to, and more importantly, why it is no longer the Sims speculum. Before closing, I wish to acknowledge the work of Deirdre Cooper Owens, whose book, Medical Bondage, explores this topic in much greater depth than I can cover here. Dr. Cooper Owens took the novel approach of studying slavery through the lens of 19th century medical journals and physician notes. Her findings are astounding and enlightening. Her exhaustive work reveals clearly the profound impact past attitudes and actions have had on today's healthcare. I highly recommend her book and her many lectures, now found on YouTube. I said at the beginning I would return to images of Lucy, Betsy, and Anarcha. So far, we have seen but 2 appalling examples. I want to finish on a positive note. On the front lawn of the Alabama State Capitol building are statues of Jefferson Davis and yet another one of Dr. Sims. I didn't notice Dr. Sims when I was stationed briefly in Montgomery by the US Air Force in the early 1980s. I did notice Jefferson Davis. It gave me pleasure to think that fixed on his pedicles, he was forced to watch the Montgomery bus boycott and listen to Dr. Martin Luther King preach from across the street at the Dexter Avenue Baptist Church. Both statues remain to this day because an Alabama law prevents removal of statues placed before 1940. Dr. Sims conveniently took up residence in 1939. While the law may keep the lawn and the statues frozen in time, it can't keep the neighborhood from changing. Down the street, a remarkable artist and activist named Michelle Browder has created a park and a dignified monument to the mothers of gynecology, Lucy, Betsy, and Anarcha. Like all great art, it commands our attention. It reveals its secrets slowly and in many languages. It rewards those who linger and listen. I will close with this brief YouTube clip and let Michelle Browder and her monument speak. Thank you for watching Black History Matters.
I'm in Montgomery, Alabama, standing with Michelle Browder, looking at her amazing sculpture that honors 3 women whose sacrifice has been lost to history: Anarcha, Betsy, and Lucy.
So Anarcha was 17 at the time of her first experimentation. There was a vesical vaginal fistula.
And Anarcha was the first patient to be brought to Sims who suffered from fistula. The other 10 or so women that he experimented on were all enslaved women who he purchased or rented, a population who had absolutely no choice in the matter. This is before the development of anesthesia, so these women were operated on, sutured, all without anesthesia.
People make the argument, oh, well, they didn't have anesthesia then. It was a crime against humanity.
Thank you, Dr. Bowen, for your contribution of this presentation. If you'd like to keep watching the rest of the video that we just previewed, please click on the link in the video description that will take you to Smarthistory's YouTube channel so that you can watch the rest of it. I highly recommend you do so, as Michelle Browder discusses in depth some of the symbolism behind the sculptures, and also there are some close-up footage of them. In addition, please help us by completing a brief survey available at the link on your screen and also in the video description box. Your feedback will help NAHOF receive funding and help plan future projects. Please contact NAHOF with any questions and if you're interested in learning more about the organization and its work. Once again, thank you, Dr. Bowen, for donating your time and contributing to this program. And thank you, the audience, for joining us on this educational journey Black History Matters. We hope to see you at our next presentation.